Welcome to the Heart of Innovation, 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global P.A.D. Association at padhelp.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global P.A.D. Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Welcome to the Heart of Innovation. In honor of Breast Cancer Awareness Month, we are continuing our powerful conversation with Sheehan Raab, a registered technologist and cardiac invasive specialist. In part one, you can find that on YouTube, our YouTube channel, at The Way to My Heart. In that part one, we delved into Sheehan's inspiring journey, her passion for helping doctors in saving lives and saving limbs through minimally invasive procedures in the Cath Lab. We also learned about her shocking breast cancer diagnosis, possibly linked to years of radiation exposure during those life and limb-saving interventions. Today, in part two, Sheehan bravely takes us through her personal battle against breast cancer. She'll share her candid insights on some of the toughest decisions no one ever wants to make in their life while fighting for their life, never knowing what decision could be life-saving or life-threatening. She'll also talk about the critical gaps she discovered in our current healthcare system and the urgent need for improved care for those facing life-threatening illnesses. Now, Sheehan's story is not just one of survival. It's truly a call to action for better protection and support for healthcare workers and patients alike. We'll hear Sheehan's powerful testimony in just a moment. But first, I want to welcome my co-host, Dr. John Phillips, who will be joining us for this very important discussion. Hi, John.
Hi, Kim. How are you?
Fantastic. And this is your birthday week, so just a little
week, huh? Okay. I'm not a huge fan of birthdays in general, but I think any time you get an opportunity to reflect on a year that's passed and be thankful for, as I've been saying, another trip around the sun. It puts things in perspective. So yeah, it's been a good day. Or yesterday was a good day, and I'm looking forward to this conversation. I thought of Sheehan this week because we're testing a new piece of equipment that potentially will allow us to take our lead off to some degree and further protect us from radiation. And I was counseling our techs because, oftentimes, and if I get too long in this, just cut me off, but oftentimes, like we as the docs we're shielding the techs to some degree from the radiation exposure. And I'm always adjusting our shielding and things. And, I'll step away from the imaging sometimes when we're doing some runs just to avoid it. But I sometimes forget to tell the techs to do that and the staff. And this week I found myself like, all right, guys, let's all move out of I call it the jet stream. Let's all move out of the radiation jet stream here. And let's all kind of protect ourselves. Because at one point there was a robot that we were using that allowed me to sit in a cockpit and steer wires and things. But the staff, our techs, were still at the table having to use it. And they would say,
and Sheehan, so we can invite her into the conveation here.
Let me just say that the techs would say, well, it's great that you can take your lead off, but we still have like, this isn't fair. And I said, yeah, you're right. I don't know, Sheehan, what do you think? Is that true?
Oh, it's so true. And I was the one at the robot exchanging the balloons and fluoroing and just thinking, wow, this is really great for you guys who are sitting down with your lead off back there looking cozy. I actually enjoy doing things, and that's why I would often find myself more interested in doing the work than protecting myself. I would love to do cases like that, or cases that were shorthand fellows, so I knew I'd be like an extra person closer. And so, yeah, it's interesting, like you said, to think about us all stepping back from the jet stream.
Yeah, and
You
I'm
might want
sorry.
to take a
No,
step
no,
back, actually, not just from the jet stream, but explain to everyone what procedures we're talking about. We talk about life and limb saving procedures, and we're talking about being in the Cath Lab. But more specifically, for those who didn't tune in part one, they might want to be brought up to speed just a tiny bit.
Yeah, I'll just say that these procedures that we're doing are under radiation. We wear lead to protect us. We have shielding to protect us from the radiation, but you're still exposed, and that's kind of part of what we're discussing. And we're all, I think, we're at ultimately at increased risk potentially for some cancer being exposed to radiation. I mean, they know that from folks that were subject to the atomic bomb. But nonetheless, like Sheehan, to your point, I would sit there and have a cup of coffee and work this joystick, and like you're in there working the devices. But I do find that the techs that are interested in these procedures, so the peripheral procedures take a little bit longer, and they still require interaction with us, the physician, and the tech. The coronary, the heart procedures that we're doing, the devices are such that really we as the physician do most of all the exchanging and things, and the tech kind of feels left out. So any technology, our radiation or our X-ray techs and are those that are interested in doing these procedures gravitate towards some of the newer technology, which was this robot that we used and actually don't really use anymore.
Yes, and it really varies in my experience, physician to physician, who kind of steps back and lets us take more of a role in the procedure or not. And that's how I often found myself in the limb procedures on the left side of the table, where there wasn't a skirt underneath, a lead apron to protect us.
Right.
There's only one designed on the right side of the table that protects the primary physician. But if you have an emergency and need to get access on the left groin or work on the opposite side, you don't have that lead skirt protecting you. And something I encountered yesterday at my own doctor appointment reminded me of something to bring up as well, which is when we get called into a case or we rush into a room and we wind up wearing someone else's lead or lead that doesn't fit us appropriately. A young girl in my doctor's office yesterday was wearing a man who she worked with lead, and her lead was draping so much that the entire sides of her breast and axilla were completely exposed. So I was able to talk to her about the importance of spending a couple extra minutes to get your lead, because your life matters. And 20 years from now, if you have to go through an experience of breast cancer like myself, you know, your employer is not going to be there with you going through everything. So it's really important for us to be able to help in limb and life-saving procedures to protect ourselves and be mindful for longevity.
Yeah, and I think that this is such an important discussion for those who are tuning in, because these doctors and these technicians that are spending hours under this radiation to open up some of the toughest blockages in your arteries in both the legs as well as the heart, they're literally, in my opinion, putting their life on the line to save your life and your limb. And they're true heroes, and they won't say it, but I will and I can. And we really appreciate all that these doctors and these technicians do, these unsung heroes, to save life and limb, and at potentially the expense of their own. So coming up next, right here on the Heart of Innovation, we're going to hear about that shocking breast cancer diagnosis and all of the twists and turns in Sheehan's journey through treatment in just a few moments. So stay with us right here on KDOW. Don't go away.
Heel to toe depth is a very important thing for biomechanics of the foot and ankle, and for everyone really. And what it will affect most is sort of the tension on your Achilles tendon, which is that big, Achilles, big tendon behind your ankle that really powers your foot and gives you that mechanical advantage when you're walking. And so people with tighter Achilles tendons, especially diabetics, can suffer from tight Achilles and can suffer from Achilles tendonitis with walking a lot or just starting an exercise program. Peripheral vascular disease doesn't necessarily make you prone to that, but it can be a little bit tougher to heal something, HEAL, heal, something if there is some inflammation that develops because you have sort of a zero drop or, sort of no heel compared to where the toe sits in the shoe. So a heel to toe drop basically is how much higher is the heel to the toe and how does your foot sit? And so when you have a 7, 8, 9, 10, 11 millimeter drop from your heel to your toe, your foot's allowed to sort of sit in almost a pseudo high heel position, a very low and relaxed high heel position. And that takes the tension off of your Achilles a little bit. And for some people, just enough to not cause any pain and inflammation. But so, if you're someone who kind of suffers from plantar fasciitis or heel pain a lot, or, ankle pain where, it's behind the ankle and your Achilles tendon, if that's something you're prone to, then it's probably best to try to find yourself a shoe with a good heel to toe drop of at least 8, 9, 10, 11 millimeters to hopefully avoid any sort of complication that you might have trouble getting through. Because the more you walk, obviously, with peripheral vascular disease, the better off you're going to be. And, the more collateral vessels you can grow and hopefully improve your condition.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips' spectacular vascular moment of inspiration.
I always love hearing the moment of inspiration.
Me too.
So my moment of inspiration actually is not a quote. It was something that happened to me this week. I ended up, a patient came to our hospital who had acute, or we call it subacute limb ischemia. So she had a procedure last week on her leg and it failed already, which is, that's a technical issue. And her foot was really hurting her and she was at risk to lose some toes. And so I did a procedure and we were able to get the vessel opened and she was very thankful. And I went and saw her the day after and, things were looking good. And I said, all right, we'll follow up. We'll see you next month or whatnot. And she's like, come here, doc. And I said, okay. So she's like, I want to give you a hug. I'm like, all right, that's cool. So she gave me a hug and this wasn't and she was in her late 60s, early 70s. And this was like a hug, like she was super thankful. And that, it just reminded me of why we do this. And yes, you had mentioned that we might be risking our lives. And I hope ultimately we're not, but we're just here to help people. And sometimes you get caught up in what you're doing, what you're not doing, what you're doing wrong more so than right. And it just felt, that inspired me, kept me going that week, just a hug from a patient, which I haven't gotten in a long time. I'm not soliciting them by any stretch of imagination, but it just
hug your doctor.
It was nice. It was just, that inspired me. And I just wanted to share that with everybody. It was really sweet of her.
I love that. Hug your doctor, hug your technician. And I didn't really realize that either until I started doing what I'm doing with the Global P.A.D. Association. And doctors say they get more thanks through me than they do their own patients. And because I literally will send notes to, and you experience it from me. Like, I tell you deep down from the bottom of my heart how much I appreciate you. Like, I don't take anything that you guys do and the steps you take to save our patients' limbs for granted. I don't at all. And every single time I am going to send you a message that says, hey, I really, really appreciate you so much. And
it's nice because healthcare, and I'm going to say this for 1 minute and then we're going to talk with Sheehan, but healthcare has become like a business transaction and it's a business. and you get caught up in the transactional nature of it. You get caught up in the, hey, we got to get people through the lab. We got to get these cases done. And you forget that they're human beings on the other end of this. And anytime we get thanks, because a lot of time we learn from our mistakes. So you dwell on the mistakes, you forget the good stuff and try to focus on the bad to fix it. But anytime we get any positive feedback, it means a lot. So I can speak for, I think, any doctor out there that we do think we like positive feedback. And Kim, we thank you for your positive feedback.
Yeah. And Sheehan, you were mentioning even in the first segment, just how much, and I can see it on your face, how passionate you are about saving life and limb. And so I imagine you don't have any regrets, even, with this diagnosis, except for maybe figuring out ways in which to cover. But you sound like you truly don't have any regrets being there, right there on the front lines and going the extra mile for each and every one of the patients that you helped.
No, I have no regrets other than, 2020 in hindsight, I would have advocated for myself to have multiple sets of lead, because our Cath Lab, we did both peripheral and cath procedures.
Yeah.
So often if there was an emergency, I would just go right in. I could care less whose lead I was wearing. And then sometimes, we had a lot of visiting physicians from all over the place. So sometimes someone else would be wearing my lead in a room. And I would be looking for my lead everywhere. It's funny, I actually still have dreams to this day where I'm looking for my lead. And so it's interesting, Dr. John, what you said about the new technologies that are emerging that could get us to not have to wear our lead. Oh, in addition to the woman's breast being exposed yesterday, she also wasn't wearing a thyroid shield.
Oh, no.
She's like 20
Probably,
something, not wearing
yeah.
a thyroid shield. And I'm just like, female, it's all of those things that I would regret in terms of advocating for more protection and perhaps even cycling myself, or people who scrub in really complex procedures, actually out of the radiation a little bit more, being more cognizant of our time in there. But someone like me, I gravitated towards those procedures and I loved it. So I got lost in the time in the room. I was nowhere else but with my patient and the physician. And I would often say, though, when you talk about getting positive feedback, by the time the patients came to me, and I would get access on their artery and veins, but by the time they came to me, they already had Versed and fentanyl sedation, so they wouldn't remember who I was anyway.
Louise, they were certainly happy, or by the time they saw you. Very relaxed.
Very relaxed. And I was always very cognizant of that. Like, I would not give any lidocaine or move forward until the patient was totally sedated and relaxed. And then when I would administer the lidocaine, I would be as gentle and slow as possible, mindful of like dental procedures I had personally, where if you just give that lidocaine a couple extra minutes, the patient doesn't feel anything as much. So I was always advocating for my patients every step of the way. And I miss it. It is something that I thrived on. And I wouldn't change it for the world, but I am really excited to see the direction we're going in with the new technologies to protect us. And hopefully get in on the education and inspiring the techs and people behind me to be conscious of everything.
And what was it like for you moving from advocating for other patients to advocating for yourself? Big difference.
Oh, big difference. It is way more difficult for me to manage my own care of one person than it was for me to manage sometimes 7 patients a day from the other side. because I was able to navigate with shortcuts, with direct communication. I had, the different numbers to everybody in every department, and I could call them immediately. From outside as a patient, you're getting one generic phone line and then you're getting transferred. And it is literally, I was timing sometimes 12 minutes before you even get to someone who might be able to communicate with your physician. As a patient, it is very challenging. And had I not had all of my experience, I would not be alive today.
And coming up right here on The Heart of Innovation, we're going to hear more about Sheehan's challenging journey through treatment for breast cancer in just a moment. So stay with us right here on KDOW. Don't go away.
One of the first case actually wasn't a critical limb case. It was a claudicant, and I was a fellow. I had a very challenging case to do in this chap who had recently retired, but couldn't really get any kind of quality of life because he had severe rest pain. He had an extensive iliac artery occlusion. And at that stage, the revascularization was not a common technique, and he was told he wasn't severe enough to have surgery. And I took on an attempt to revascularize a pretty extensive aortoiliac occlusion. Was lucky enough to be successful with that. And I got a lot of positive feedback from the other clinicians who were looking after the patient. But more importantly, received, when I saw him in clinic, he basically burst into tears saying it was the single thing that has changed the quality of his life. And he kept in touch with me regularly over the next few years. And really that emphasized the impact of what we do with a carefully planned and technically successful procedure at a patient level. And that struck me and drove me really from there on.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org.
Welcome back, everybody. Thank you for joining us. Part 2 of our interview with Sheehan Raab. And Sheehan, you said something before. This was, I guess I would call it a teaser, but it kind of stuck with me. Before we went to break, you said if it weren't for your experience, you would not be alive. Are you referencing the fact that you kind of knew the healthcare system a little bit and could kind of backdoor your way into things? And because we were just talking during the break about this, and I wish it's not feasible, but like when somebody texts me, I really make one phone call and I can get that patient seen, as opposed to the normal channels of hitting this button and that button and then going to a centralized scheduling and a call center and not, getting scheduled at some point in the near future. I don't know how to fix it, but again, just explain a little bit, if you could, what you meant by that statement.
I'd be happy to. I guess the biggest advantage that I have is knowing the language and knowing how to communicate. So I know medical terminology. I know how to cut through and actually advocate for myself in ways that was very powerful. And even at times that my dad said to me when I was in the emergency room, having a complication from chemotherapy, I was dying. All of my labs were not compatible with life. They repeated them 4 times and it never changed. And my blood was black and thick. And I knew I was dying. And I had to communicate and say to them, like, I need you to take action now. I know that it says not compatible with life, but I'm alive and I need you to do something. And my dad said to me, like, he calls me Goose. He's like, Goose, thank God you worked with Dr. Moses for so many years, because you started talking like him and directing your own care. And I'll show you guys a photograph from that time. so you can kind of see where I was. A picture's worth 1,000 words. And
yeah, that's so amazing that it is. Wow. And we're seeing the picture. If you're joining us via radio, you got to go to our youtube.com/The Way to My Heart channel to see these pictures. It's just heartbreaking.
Here's me receiving a blood transfusion finally. And now at this time, right after the blood transfusion, I had to get potassium. My potassium was extremely low. And as a cardiovascular technologist, I know that low potassium could now lead to me having a heart attack.
Yeah.
And so they started infusing potassium, and it is painful. So they gave me some narcotic pain medication with it. And my hands started swelling up, and I was in excruciating pain. And so I kept calling for the nurses to check my arm. And they actually said to me that they thought I was trying to seek pain medication. And I actually, at this point, had to angrily say, check my arm, take this drapes off of me. And sure enough, there was a tourniquet tight on my arm. So none of the medication was getting in, not the potassium or the narcotic that they were giving me. So here's where this is in under like 24 hours, 2 circumstances that I had to stick up for myself when the wrong thing was happening, because people make simple mistakes all the time, and they're busy. So they just want to move on and dismiss you as a patient. And so thankfully, I knew the languaging, and I stayed conscious and advocated for myself when things were wrong.
Wow. And you had to keep telling yourself, I imagine, stay awake, stay awake, stay awake. I can imagine
stay conscious. What I felt was like, if I lose consciousness, I'm dead, because then I'm in their hands. How sad. I mean, that was my thought, because I'm in an emergency room and just left in a room. Like, people are not taking action. They're dismissing it like it's just an error in the lab.
And I mean, I know we only have like 30 seconds left, but it's difficult. I mean, the ERs are overcrowded. They're people using for primary care. They're not really emergency rooms anymore. And the staff's overworked, the physicians are overworked. And now too, you sit behind a computer and you put your labs in. You probably check in with the patient once and then that's it. And so it's a difficult situation. It really is. I feel for you though. That's tough.
That's what I mean. And that is just one day.
And coming up right here on the Heart of Innovation, we did just hear about one day. We're going to hear more of Sheehan's terrifying journey through breast cancer treatment and management next, right here on KDOW. Do not go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of P.A.D. or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to P.A.D. and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair.
sure close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with P.A.D.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org.
Welcome back, everybody. Thanks for joining us. So, Sheehan, I want to get right to it. So we've been kind of skirting around this topic, but you were diagnosed with breast cancer. Tell us about what treatment options you were given, what you ultimately pursued, and how that whole process was, because there's obviously some positives to this. You're here talking to us, sharing your story, being an advocate.
Many positives. I'm alive. Even the photos I showed you where I was bald. I mean, look at how long my hair is. And I'm on all of these medications that stop hair from growing and cause thinning hair. So there's no real limit to our healing ability. And that is the best news. Our body wants to heal itself. Like you see when you have a cut on your arm, really, even if you don't do anything to take care of it, it's going to heal. So a lot of my journey was learning what to eliminate that was potentially toxic in my life, whether it was different things that were household products or things on my clothes or even people in my life. Because when you're fighting for your life, you don't really have time for a lot of the toxic stuff that you tolerated before you got really sick. So my journey, thankfully, I actually scheduled one consultation first, and it was at Lenox Hill Hospital. And I put all my chips on it and thought it was meant to be because I worked there for so long. And it wound up just not going well. I liked the physician's plan, but she wound up revealing things about my chart in front of my dad and brother that was inappropriate. And so I didn't want to go back, and it kind of broke my heart. But on my way home from New York, I knew this is why you do more than one consult anyway, because it might not be perfect at first, right? And you might not be a match with that doctor. So I knew better, but I put all my chips in that one container at first. On my way home, I actually scheduled 2 more consults, one at Fox Chase and one at MD Anderson Cancer Center. And I wound up going with the physician where out of the 3 doctors, 2 of them agreed on a treatment plan. And one was an outlier. So I went with the one who wanted to do an MRI first. I liked her treatment strategy to see the whole picture and not just do a single lumpectomy. And that was another potentially life-saving decision, because the doctor who I wound up seeing, Dr. Kristen Brill, had been doing it for 19 years And she had a mix of intuition and experience, which is what you really want in your doctor, because that means they're treating you as an individual, but also are experienced of seeing many. And so she would go off of feelings, like there's this one spot in your MRI that I don't really like, and I have a feeling it might be cancer, even though it didn't say it on the MRI conclusively. So she wound up going out of her way. I had many biopsies done. Some were inconclusive. So she went out of her way to do a lumpectomy in that area 2 weeks before she scheduled me to get a double mastectomy, because I felt at that time that no matter what, whether that was positive or not, with my age, I was under 40, and the size of the lump, and then this questionable thing on the other side, I just felt like I'd rather be safe than sorry. The other way of looking at it at the other institution was to do the lumpectomy, and they were picturing a double mastectomy, as they said, not every thing needs to be hammered. Do you know that saying, Dr. John, about what is it? Not
well, no, I mean, when you have a hammer, everything's a nail.
When you have a hammer, everything looks like a nail. So they were deterring me and trying to sell me, if you will, a minimally invasive procedure. And they were talking about breast conservation. And I just thought to myself, well, what are we conserving if there's something in my other breast and we don't know about it? That was just scary to me. So I decided to go with Dr. Brill, who wanted to do a baseline MRI, see the worst case scenario, and then treat that way. I felt like the last thing I wanted to do was have a lumpectomy, radiation, and then 6 months later have the MRI and find disease in the other breast. So that was my strategy. And it took about 6 months for this to, from finding the lump, things don't happen quickly. And it wasn't based off of my consults. I had them all scheduled immediately. So no delays were on my behalf, but I've spoke to many other women too, and it's very common from the time they find the lump to not have their surgery or treatment for 6 months. So in that time, I was researching and doing everything I could holistically, natural health wise, to facilitate that natural healing in my body as best as possible. And I really went down every trail in that, including like extreme things. I did a 9-day water fast. I wouldn't recommend that to the audience. And I would also tell the audience, proceed with caution with a lot of these holistic claims. You really want to be careful.
Yeah, I would imagine that's a really good point, because we hear all the time, oh, here's this person and they're sharing their cancer story that they ate a whole bunch of red grapes and that's all they ate and they were cured. Or this other person who did some sort of grounding or audio wave therapy, and it cured it, and thousands and thousands and thousands and thousands of dollars later, you don't have that same result.
And it's spread and it's metastasized now to your bones.
Wow. That's so scary. Well, coming up right here on the Heart of Innovation, we'll have final thoughts from Sheehan L, Raab, and it's such a powerful story. I'm almost, speechless here. But we're going to continue in just a moment. So don't go away, right here on KDOW.
Heart of Innovation. For more on today's topic, go to theheartofinnovation.org.
Welcome back, everybody. Thanks for joining us. So, Sheehan, we have 4 minutes left. What do you want to leave our listeners with as it pertains to your journey and where you're headed tomorrow, next week, next month?
So I learned some things that I would like to just share with you that could be beneficial across the board, no matter what you're facing, dis-ease wise or with your health journey. These things are stressful and it's really hard to remember everything. So take a piece of paper and a pen. Another thing, take the time to write down questions for your doctor and things that you want to review, because you want to maximize your time with the expert consultation. And you don't want, if you're like me, you could talk and get sidetracked and forget to mention things on your list that are crucial. So I would always get the ear of my physician until we answered every question, and they would really respect the fact that I had it written down. And so that's one way that I recommend to all of you. That's kind of simple, and it helps keep the doctor with you and maximize your consultation with them. Another thing is, in terms of the stress, there's some really simple things that you can do to ease that include your 5 senses. So just being conscious of like what you're smelling in the area, what you're hearing. I started taking a cup of hot tea with me, because when I would get stressed or nervous talking to my doctor, it would calm me down to just smell the tea. Just smell the tea, just calm down. Because again, it's really easy to get stressed out in these circumstances, and then you do forget. I mean, I would forget everything. So that is really just little simple things that you can do to support yourself in these situations. And for the healthcare providers, really slowing down a little bit and being the advocate for each one of your patients and yourself, despite how busy you may be, because busyness, I think, is probably the biggest disease that our entire society suffers from right now. So it's important to take a deep breath, take your time, and really connect with each other so that we don't have these mistakes and we are unified as a team. It really is helpful.
Thank you so much, Sheehan L. Raab. We really appreciate you so much for sharing your powerful story and offering some amazing advice for other people who might be going through the same journey and those who are treating those along the same journey as you. Thank you from the bottom of my heart. And thank you, everyone, for joining us.
Thank you for having me, and happy birthday, Dr. John.
Thank you.
I wish I could come scrub.
I know. I can tell, like, that's the thing. You're somebody that would jump. I mean, I could just see you jumping into cases and kind of, no holds barred, going at it. And that's great. That's fantastic passion, honestly. But it comes scrubbing. That's a lot of exposure. You mentioned that in the first interview. You were there scrubbing and scrubbing and scrubbing. and it takes a toll on everybody, not just the radiation, but the lead is heavy, and I mentioned it before, the orthopedic injuries, and it's real. It's real.